Viewers, welcome to your number one health show, Health Zone, on Baina TV. So tell us, what is G6PD deficiency?
Okay, thank you for having me on your show again.
Join me and my guests this and every Wednesday at 4 p.m. on Baina TV. Baina TV, connected to your world. Good evening, welcome to Health Zone on Baina TV. This evening, our topic is endometriosis. So one may ask, what is endometriosis? Endometriosis is a disorder in which tissue similar to the tissue that forms the lining of your uterus grows outside your uterine cavity. The lining of the uterus is called the endometrium. Endometriosis occurs when endometrial-like tissues grows on your ovaries, bowel, and tissues lining your pelvis. It's unusual for endometrial tissue to spread beyond your pelvic region, but it is not impossible. Endometrial tissue growing outside your uterus is known as an endometrial implant. The hormonal changes of your menstrual cycle affects the misplaced endometrial tissue, causing the area to become inflamed and painful. This means the tissue will grow, thicken, and break down. Over time, the tissue that has broken down has nowhere to go and becomes trapped in your pelvis. This tissue trapped in your pelvis can cause irritation, scar formation, adhesions in which tissue binds your pelvic organs together, affecting up to 10 symptoms. The symptoms of endometriosis vary. Some women experience mild symptoms, but others can have moderate to severe symptoms. The severity of your pain doesn't indicate the degree or stage of the condition. You may have a mild form of the disease, yet experience agonizing pain. It's also possible to have a severe form and have very little discomfort. Pelvic pain is the most common symptom of endometriosis. You may also have the following symptoms: painful periods, pain in the lower abdomen before and during menstruation, cramps 1 or 2 weeks around menstruation, and then heavy menstrual bleeding or bleeding in between periods. So that's why last week when we talked about dysmenorrhea, menstrual cramps, we indicated that endometriosis was one of the causes of secondary dysmenorrhea, the type of dysmenorrhea that occurs because of an underlying cause. So that's why endometriosis is here again. So other symptoms will include heavy menstrual bleeding or bleeding between periods, infertility, pain following sexual intercourse, discomfort with bowel movements, lower back pain that may occur at any time during your menstrual cycle. You may also have no symptoms. It's important that you get regular gynecological exams, which will allow your gynecologist to monitor any changes. This condition can disrupt your life if it's left untreated. Endometriosis has no cure, but its symptoms can be managed. Medical and surgical options are available to help reduce your symptoms and manage any potential complications. Your doctor may first try conservative treatments. They may then recommend surgery if your condition doesn't improve. Everyone reacts differently to these options. It's frustrating to get diagnosis and treatment options early in the disease because of the fertility issues, pain, and the fear there is no relief. This is difficult to handle mentally. Consider finding a support group or educating yourself more on the condition. The treatment options may include pain medications. You can try over-the-counter pain medications such as ibuprofen, but these aren't effective in all cases. So in some cases, you may take the pain medications, but it may not be effective. Another treatment is hormone therapy. This includes taking supplemental hormones that can sometimes relieve the pain and stop the progression of endometriosis. Hormone therapy helps your body regulate the monthly hormonal changes that promote the tissue growth that occurs when you have endometriosis. Hormonal contraceptives. Hormonal contraceptives decrease fertility by preventing the monthly growth and build up the pain in less severe endometriosis. So in the more severe ones, it might not be able to work, but in the less severe ones, birth control pills and vaginal rings, also patches, are able to help out. The Depo-Vera injection is also effective in stopping menstruation. It stops the growth of endometrial implants. It relieves pain and other symptoms. This may not be your first choice. However, because of the risk of decreased bone production, weight gain, and an increased incidence of depression and some releasing hormone, agonists and antagonists, we are still on the treatments. So women take what are called gonadotropin releasing hormones, hormone agonists and antagonists to block the production of estrogen, which stimulates the ovaries. Estrogen is the hormone that's mainly responsible for the development of female sexual characteristics. So blocking the production of estrogen prevents menstruation and creates an artificial menopause.